Did you text him, Kevin? Okay. All right. Okay. Well, hello, everyone. My name is Burdetta Hodge. I'm the president of Tempe Union High School District Governing Board. And for the safety of our board members and community, the special study session is being streamed live. A link to the audio recording will be available at the district website by the end of day by Friday. I call this study session to order. The time is now 5:02. Let the record show that we have all of our board members participating using Google Meet. After the study session presentation and all questions have been answered, sorry, I'm a little ahead of myself. So let me start off by saying thank you for being here today, and we'll get started and call this meeting to order. Okay. So it looks like like I said, we have all 5 board members ready, and I'm going to turn it over to Dr. Mendeville.
Thank you, Madam President, Vice President Garcia, members of the board, executive team members, principals, assistant principals for activities, assistant principals for academics, assistant principals for athletics. I mention all of those team members for a reason, and that is because everyone has to pay attention to this study session and the information that we will be sharing during this study session. And I also welcome our public who's listening out there, our parents and families and students, if you're listening too. So we appreciate you tuning in. Tonight's study session is around the health mitigation plan for the district that parallels and coincides, and we rely on the health mitigation plan for a reopening of our schools, given the fact that the metrics are changing, and they're changing in a favorable direction for now. So today is the study session where we're going to be talking a little bit more about each of those areas, the 2 components. And Mr. McDonald, if you can go ahead and put the presentation up, it'll now make more sense. So our safe return to in-person instruction. So again, I welcome everybody. Next slide, Sean.
Letting me move it. Hold on. There you go.
Yes. And part of why we're here is to be in compliance with the executive order that the governor released a number of weeks ago. It seems like forever ago, but it's an executive order that we've been following. And there were 2 key items in order 1 that we will be discussing today. And that, first of all, is providing you, the governing board, with a recommendation as to when in-person teacher-led classes can safely be made available to our students and families. And then the second piece is to provide you, the governing board, with the mitigation plan for its consideration and approval, which we have done. We've posted, and we're going to be sharing in detail what that actually means and what that would mean for the sites, and to entertain any of your questions for the plan itself. Thank you. So we're going to be touching upon these bullet points. First, the Department of Ed and the Arizona Department of Health Services. As you are aware, they have been in development in cooperation with providing the guidance documents to support the safe opening of schools across the state. We've already received the benchmarks from the Arizona Department of Health Services, and we'll be sharing those and how that translates to Tempe Union High School District. We are a large district. We encompass a large chunk of land, and we also have a high open enrolled number of students. So we'll be talking upon those points under that bullet. But the 2 key components that we're going to spend a lot of our time this evening are going to be our schools mitigation plan, the how. How are we going to do this? And truly the success of the reopening is going to be contingent upon this piece, the quality of our schools mitigation plan, how that's going to translate to the school sites. The metrics, for the most part, can speak for themselves, but because we have to be very cognizant of the degree of community spread. But both components are important in determining a safe reopening. I can't emphasize that enough, and I know that Mr. McDonald will be doing the same. Also, the Arizona Department of Health Services recommends 4 reopening scenarios. Mr. McDonald will be sharing those 4 in detail as well, along with the health mitigation plan. And then after each section that he shares, there'll be a Q&A opportunity for you board members, okay? So first, understanding the benchmarks. And again, Mr. McDonald is going to go over these in greater detail, but as you know from the metrics that were shared that we have to use from the Arizona Department of Health Services, understanding the benchmarks, and that's what this slide is all about, and the cases. We will be relying on the 2 weeks of data for each of these areas. The percent positivity, and that's the 2 weeks of percent positivity below 7%. And then the COVID-like illness. Those are 3 benchmark areas that we're going to be talking about. They're in the news all the time. They're on the website, but those are 3 key benchmark points that we have been monitoring and will continue to monitor. And right now, I know many of our families have looked at the Maricopa County Department of Public Safety, and where our region is in Maricopa. And if we look at that, then we really are not prepared just quite yet, but we are moving in a favorable direction. And again, Mr. McDonald will be talking a little bit more about this particular dashboard, but these 2 pieces of data points in terms of the charts and data are what we've been following for several weeks now, since we've been given the metrics. So as I mentioned earlier, the key piece in any consideration of returning to in-person instruction, these 2 are equally important. The mitigation plan, how we're going to keep our kids' health and our students healthy and safe, our students and our teachers and staff, and then the level of community spread through those metrics. Component 1, the health mitigation plan. The how, how are we going to reopen safely? And that's the question we all have been asking ourselves for weeks now. Understanding all the procedures and the guidelines and protocol from CDC and from our own state agencies. Strategies outlined on how the school will reduce the spread of COVID-19 among students and staff. Again, the how is real critical. And then the quality. Do our employees understand the plan? Do the employees understand their role with the plan? The plan's been posted on the district website. Again, I can't emphasize enough how important it is for everyone to fully understand the importance of the plan to open safely. And then the component number 2, level of community spread, the when of the reopening. We don't really have a date. We've been thinking maybe sometime later in September or late September, but we really don't know. We need to have a bit more data points from which to reference, and new data will come out tomorrow on Thursday at the end of the day. There are thresholds that have been established that are consistent with the national standards set by the Coronavirus Task Force, and those are embedded into those 2 charts.
Thank you, Dr. Mendeville. I'll go ahead and start. Madam President, governing board members, other guests, we appreciate you being here tonight. These components are not easy and they're lengthy, but we feel it's important to make sure that all of you, and of course all of our principals and assistant principals in the community, understand the idea of component 1, component 2, and then the scenarios that we'll look at. There will be an opportunity, as Dr. Mendeville, to ask questions, so I'll stop after component 1 is completed, and we'll be able to answer any questions that you may have about component 1, the health mitigation plan. So the health mitigation plan is a document to help the district in making some decisions for reopening their schools during COVID-19. It is also part of the document that fulfills the requirement of Governor Ducey's Executive Order of 2020-51, which is Part 4C. There are many things that we need to consider, and Dr. Mendeville talked about the behavior. Perhaps the behavior is one of those things that are most important, as we see if we do not do the proper behavior of the mitigation plan. That is where we're finding we need to, during our contact tracing, quarantine people that may have not been using the mitigation factors. Some of these mitigation factors we'll talk about a little bit more in length, and I know that you received this document a little bit earlier today, so I won't necessarily read everything, but I will touch base on many of the things that are going to impact, of course, our families and our community and our staff as well. Personal hygiene and safety for all students and staff is going to be very important. Face coverings, also we could call them face mask, not the same as a face shield. You can use a face mask or face coverings. A face shield needs to be in conjunction with a face mask. Hand hygiene and respiratory etiquette, physical distancing. We'll talk a little bit about school building protocols and modified layouts. And of course, when we go back into a hybrid setting, the smaller class size, if and when possible to do so. Some of the items when we talk about personal hygiene and safety, we want to ensure that we're maintaining at least 6 feet indoors and 10 feet outside distance from other people. Covering your cough with sneeze into a tissue. We would like for people to make sure they throw away their tissues in the trash and again, wash their hands. If you are one that sneezes into your elbow, we just ask you that you don't use your elbow to greet people. That happens occasionally. We want to make sure that we remember not to do that. Want to make sure that appropriate face coverings that cover your nose and your mouth. We have disposable masks, cloth masks, and other facial coverings that we'll talk a little bit more about. We know that washing your hands are going to be very important with soap and water for 20 seconds. We'll talk a little bit further about that, but if soap and water are not available, the use of hand sanitizer that contains at least 60% alcohol is going to be available for our students in each classroom as well. Of course, we want people to not touch their eyes, nose, and mouth. Clean and disinfect frequent touch objects and surfaces. We are asking currently our staff to do that for their own areas as well, just so they feel good. But we're also doing that heavy cleaning on a daily basis with our maintenance staff. Probably first and foremost, as educators, we like to be at work. And when we feel sick sometimes, we tend not to stay home. We rough it through. This is going to be imperative that if we're not feeling ourselves, that we stay home when we're sick. So it's very important. Here's face coverings, and we're going to talk about face coverings for students and staff. It is required to use the appropriate face covering when age and developmentally appropriate. And so we also need to remember that a face covering doesn't excuse having to be socially distant of 6 feet or more. We do recognize that we need the students to be wearing a face mask when waiting to enter the building. So coming into the building, while on school grounds and in the classrooms, except when they're eating and drinking. And they must be socially distancing when they're eating and drinking as well. While leaving the school, and then also mandatory while riding on the bus or school bus. And that's the same for our staff. And I wanted to note that these are mandatory requirements. And the picture of the face coverings are examples. You may have heard a little bit about Duke University talking about the neck gaiter. And there's some interesting controversy going on with the different face coverings. Things that are important about face coverings is the fit, making sure that it fits snug. how many plies the face covering might be, and things of that nature. At this point, the CDC does allow all of these face coverings to occur. Hand hygiene and respiratory etiquette, again, the idea of washing the hands, if not available, using the hand sanitizer, covering your coughs and sneezes. And then also, it's going to be important for us to be able to assist any of our students who have any physical or emotional disabilities that they're having difficulty with proper hand washing techniques, and look for alternatives for that practice. This is what we will use, proper hand washing technique, and most people will say, yeah, I know how to do that, but I bet number 9 and 10 is a little bit different for people. So do not turn off the water until you dry your hands thoroughly, and then with the paper towel, turn off the water, and then you'll get something with physical distancing. We talked a little bit about when Tempe Union is able to come back into school, we need to adhere to the following CDC recommendations. And those are going to have to maintain that 6 feet or more for physical distancing in our classrooms, hallways, bathrooms, offices, and other common areas. We want to try to minimize as much movement of the students and staff as much as possible, and also create this idea of a route system where we have one-way routes and different options. We need to make sure that the interaction between the large groups is at a minimum. Again, we're still under the executive order that we can't meet in larger groups or venues more than 50 at this time. On a school bus where sufficient physical distancing is difficult, we're going to definitely make sure that there, and I'll show you a copy of when we get to transportation of what a bus might look like. And of course, everybody on the bus will be wearing their face mask, being socially distant. We're going to post signage and set up barriers and make sure that we have entry points and exit points that are located, and also signage that explains safety protocol and expected behaviors. And the principals and the assistant principals have been doing such a good job in setting up their campuses and putting their signs up. Just wanted to do a shout out to them for all the hard work that they're doing to set up their campuses. As currently we have some students who need some extra support come on to our campuses. I want to also have you remember that face coverings are not a replacement for physical distancing. They should be used to mitigate virus spread when physical distancing is not feasible. And that's very important that we're really always wearing our mask. Some school building protocols that we want to make sure we talk about. We'll talk a little bit more about modified layouts and creating smaller classes. As far as the water fountain, we're going to discourage that, but we also know that our touchless water bottle filling stations will be available for use whenever possible. We also tested those safety, and we had Maricopa County come out and look at our water facilities, and our water is safe for students to be able to use and staff to be able to use. When we talk about a little bit about modified layouts, it's very important that we look at spaces, that seating and desk, making sure we're meeting that physical distancing in the classroom. Again, 6 feet or more if we can. We're going to assign seating. That will help us track the virus spread when we're doing contact tracing. If a student has assigned seats, then we know where they're sitting on a constant basis and who is around them to be able to support maybe an exposure. We want to make sure that desks are all in the same direction. And I know a lot of our teachers like to use collaborative teaching and collaborative tables. In this case right now, it's a little bit unsafe to have students be in close proximity and be facing each other. So we're going to ask that they sit in the same direction, and they also sit in the same direction during lunch. We have installed physical barriers such as sneeze guards and partitions, and you'll see those in the reception areas at not only the district office, but all of our sites as well. And then also physical guides, tapes, floor signs, signs on the walls, where it's sharing about 6 feet apart, where the entries are, one-way routes, arrows, etc. And then we're doing screening policies to accommodate all students, including students with disabilities. This is an example of what a smaller class size would look like. Now, that doesn't mean we're going to take the tables out, but we might cross or put some painter's tape on the tables that have X's on it. But this gives you an idea of what the social distance classroom could look like. We could take out the tables, we can keep them in. More than likely, we keep them in and just X off those tables that were not being used. And then again, the students will be able to sit in the same chair as they are. And then each night, of course, we will be doing significant cleaning and deep cleaning of the classrooms. We're going to try to limit groups as much as possible. This is a lot easier to do in elementary schools and middle schools. This is called cohorting. What we'll be able to do is cohort by the day. So we'll have a group, and then in case we need to look at doing closure of that day, we could close the cohort of that day as opposed to all days. And then, of course, we want to make sure that our students are not being, segregated by students with disabilities, making sure they're in our classrooms with non-disabled peers just because we're making these smaller classroom opportunities. The next part that we're going to talk about is how do we maintain the healthy environment and operations. There's going to be screening guidelines for both staff and students. While we're in scenario 2, 3, and 4, that's the current scenario we're in, the hybrid scenario, and an intermittent scenario just in case we have to go back or forth. We'll talk about what that looks like for visitors and guest speakers and volunteers. We'll look into transportation a little bit more, nutritional services, large group gatherings, and Mr. Alpine did a great job speaking to the athletics and extracurricular activities, so we won't spend too much time on that as he did that last week, but talk a little bit about that, and of course, cleaning and disinfecting of our environments. When students are entering campus, we're asking them to do a passive screening prior to coming to school. And parents and guardians, if you would, it would be really important to make sure that your students aren't having any COVID-like symptoms of fever or cough or different things of that nature. There was a thought or question earlier about flu. When flu comes around, there's a lot of the same symptoms. And we want to make sure as well, if you're sick, please stay at home, monitor your illness, and make sure that you're communicating with the school. When the student or staff gets to school, we'll do an active screening. We will be asking the 3 COVID questions that we have been asking, verifying that they have not traveled into one of the hot spots in a country, verify that they do not have a fever or symptoms, and verify that they have not been around anybody with COVID-19. Tempe Unit will also follow established guidelines for triaging students in holding areas. So if we have a student that happens to come to the school and say has a temperature, we have holding areas which will be able to monitor by the nurse. And then we also have confinement areas in case they need to be confined until a parent can come pick the student up. Of course, students who are symptomatic need to be separated. And then, of course, we'll wait for that to, in the containment area, and monitor them and help support them until their parent is able to pick them up. And then we will work with the parent and talk about what does it look like, the CDC criteria, and how they continue their home isolation. And also talk about, though we won't, we will encourage testing for COVID. Same things with the staff when entering campuses. We'll help support them if they don't have a ride, and figure out how we can get them to where they need to be in a confined area, and then work from home. As far as visitors go in scenario 2, which is the hybrid model, we'll speak about these scenarios a little bit later. COVID-3 is our current scenario, which is virtual, and then COVID-4 is an intermittent stage. Visitors and volunteers, excluding our parents and guardians, and of course our employees, will not be allowed in the school building without permission from site administration or principals, or from the superintendent when necessary. Of course, our essential guests, our social service workers, our police, our fire, our EMS will be permitted to access the buildings. As far as approved visitors, so an example would be parents coming to the school to pick up their students. We will continue to use the Raptor Visitor Management System as before. We'll continue to do the screening protocols, asking the same questions, and taking the temperature of all visitors before they're able to enter the building. And all other visitors will be welcomed back when we come into scenario 1, which hopefully will be soon, but scenario 1 will be when we're welcoming back all students to our campuses. As far as transportation, they too will engage in active screening. Again, we'll be doing temperature checks and wellness checks. We do have several no-touch thermometers or infrared thermometers that we are taking temperatures, and Mr. Riley in purchasing is looking at some other opportunities for temperatures to be taken in large groups, which will help support students coming into our building and not have to be waiting for a long period of time. The district is looking at the temperature. We're looking at wanting it to be a little below 100.0 degrees. CDC will say 100.4, but our nurses really do feel passionate about having that equal number. As far as physical distancing, we'll create a barrier between the students on the school buses. And I'll show you a picture of what that will look like on the next screen. Our bus drivers will wear appropriate face coverings as well while they're transporting our students. And they'll also be cleaning and disinfecting the buses before and after each route. A question of PPE, we're going to have extra supply of PPE materials on our transporting vehicles, so our buses will also have extra supply of PPE upon the entry points at our school as well. And we wanted to thank, next week I sent in a couple donations from our community, City of Phoenix, Maricopa County, lots of different groups are sending in or donating things to us, so we appreciate the community for their support. This is an example of what our buses look like. We have a normal capacity of 56 seats on our bus. If we were doing the socially distant capacity with no mask, we would only be able to put 7 students on a bus. And talking to Mr. Gonzalez, our Director of Transportation, we have decided to go with the capacity of 28, and that's the lower bus that you see there with staggered seats, every seat. And we're able to get 28 students on the bus, but they have to wear their mask on the bus. As far as nutritional services, wonderful Director Julie is making sure that our schools are partnering with the Food Nutritious Program. They're creating plans to adhere to social distancing requirements and meet the specific needs of all of our individuals and our sites. This includes several students we might be serving students in the classrooms. We're implementing social distance practices in our cafeterias and also in different other open spaces. And again, the principals are doing a tremendous job with this on their sites. As far as large group gatherings and athletic and extracurricular activities, we do know that the Sports Medicine Advisory Committee for the AI will be meeting shortly. We do have athletics continuing at this time, but we have an update in probably the next week. Extracurricular activities are currently remote. As we start, we hope that we can have some social distancing mitigation strategies that will allow kids to actually meet in clubs and different options of that. Lastly, right now, field trips are going to be prohibited until we can get to a scenario level that allows us to be doing a field trip in a safe format. As far as cleaning, we are going to adhere to the CDC cleaning guidelines in order to maintain a safe and healthy facility. We're always going to be disinfecting high-touch surfaces all throughout the day. And if you were to go to one of our campuses, we have the maintenance always touching up on door handles, crash bars, handrails, different things of that nature. Restrooms are being cleaned on a regular basis, and our water stations as well. Our athletic equipment is being disinfected by the appropriate staff members, whether that be our maintenance or our coaches. And a big shout out to the coaches for doing a great job in trying to help support, continue to support our students and keeping a safe environment. After students will leave the building, all classrooms, restrooms, and other occupied areas will be thoroughly cleaned and disinfected. We do have a new checklist for our maintenance to sign off on, and every time we finish up a room, we will put a piece of blue painter's tape on the door that actually seals the door jamb, so that the teacher will know that their room were clean for the night. And then also we will be talking about doing a deep cleaning that will occur once a week. We also need to protect our vulnerable individuals. We do have some students that are at higher risk for severe illness. So we do have a flexible attendance practice, and shout out to our APAs, our academics that are really helping assist with this, and helping with the documentation that goes along with that. And then also we have opportunities for students to participate in 100% virtual learning programs. In continuation with that, for our staff, they are protected under the COVID law, which is the FFCRA, and the FMLA laws for staff that may have a higher risk for severe illness. I wanted to thank Lisa Laura and Dr. Keller in HR for helping support our staff, working on a daily basis to make sure that they're able to use their flexible sick leave, be able to telecommute, perhaps have modified job duties, cross trainings, and such as that. If we have a suspected or a positive COVID-19 response, if they're at home, parents and guardians were asking that you would notify your school administrator or school nurse, and so that we know and how to help support you. Students will remain home in accordance to the CDC guidelines, and they'll have a couple options. After students show or staff members show symptoms, at that point, anyone can get tested. However, if they were just exposed, the CDC recommends that the student or staff waits 4 to 5 days. And that's where we'll help our staff to be able to telecommute or work from home, or our students to continue to work virtually. For our employees, they need to make sure they're notifying their immediate supervisor. We will continue to work with the local health department, especially if we're having some sort of an outbreak. And to this point, we haven't had an outbreak. We've had symptoms, and we've had ones that tie together, but we'll talk about outbreaks later. But that would be 2 or more positive cases that didn't have any connection to them. Tempe operations will consult again with the local health department to determine if a closure is needed, whether it be of offices or certain areas, facilities, school buildings, or an entire division. The district operations department will report any outbreaks, and again, having more than one case within the school does not constitute an outbreak, but an outbreak is defined as 2 or more lab-confirmed COVID-19 cases of students and staff with the onset of over 14 days. The thing with this is that they can't be identified, can't be in the same household, can't have close contact, can't necessarily be connected with a case investigation or a contact tracing. Similar to determining when to reopen schools, the decision to quarantine a class or close a portion of the school, we will definitely be making, or the school in entirety, will be making that coordination with our local health department. As far as the importance of the context of local spread and the school mitigation plan, we must consider both in order to do that. And then again, our schools will be prepared for virtual learning when one or more of the benchmark categories falls within the substantial spread category. And lastly, but not least, social emotional wellness. In addition to our physical safety, Tempe Union it's critical to focus on the mental health and well-being of its staff and students. Our mental health concerns can be identified and supported both home and at school, and it's important for Tempe Union to consider mental health for its entire school community. So at home, Tempe Union will educate and support families on identifying the indicators and signals of staff and students who are suffering from anxiety, depression, lack of coping strategies. And we are noticing and being able to support our students. We do know in isolation or not being around their friends does impact our students, and I am pleased to say we are having a crisis response with our resources and our human capital that we have, and our counselors and our Care 7 people that we're reaching out to our kids and making sure we have communications. We are also working with our parents and email communications, social media, school, district websites. We're having parent workshops coming up, and of course, Tempe Care 7. As far as through school, we're ensuring that the staff is trained, and through the Mitch Warnock Act, of course, we are going to be doing a training called Acts on Facts, which will train all of our staff, both classified and certified, on suicide prevention in order for us to make sure we see the indicators of our students who are suffering from anxiety and depression or lacking those coping strategies. We will continue to work with Teen Lifeline, and all students on their back of their IDs do have that phone number to support them when they're in need. Some other methods to promote social emotional wellness. We really need to encourage everybody to take breaks from watching and reading and listening about news stories when it comes to COVID-19. This includes social media, especially if they're feeling overwhelmed or distressed. We need to promote employees and students to eat healthy and exercise and get sleep more than ever, and make sure that they're finding time to unwind. We need to encourage employees and students to talk to people that they trust and about their concerns and how they're feeling. And we also need to ensure staff that they're educated on the signs and symptoms of anxiety and depression. And we'll be sharing the Acts on Facts PD this week with our staff. So we're very excited about that. These are our COVID response contacts, and I just wanted to thank this group. They've been doing a lot of the contact tracing as well, supporting their schools. They do have a backup with another assistant principal. And then I also wanted to recognize our nurses at this point who have taken a response when it comes to COVID-19. And together, all of these groups have really made a great impression and really a great safe environment for our students and our staff. So that will complete component number one, the health mitigation. I'll go ahead and open it for questions and answers. And so I won't be able to see you.
Sorry, Mrs. Lau?
Okay, so I just have some really general questions. Can you hear me?
Yes, ma'am.
Okay, so I was curious about two things about our buildings. Do many of our classrooms have sinks?
No, they do not.
Okay, it's science though, does, right?
Science has sinks, culinary has sinks, not many more than that.
Okay. The other question I had is about ventilation in our schools because we have very few windows. I think the older schools have more abilities to open the doors than the southern schools. Have we done anything to increase ventilation? I know a few years ago, if you recall, at Corona, we actually drilled holes throughout that school for a different reason, but to create more ventilation. Are we addressing that at all, or is there anything we can do on that?
We are addressing that. Thank you for the question, Mrs. Lau. What we're doing right now is that we're working with our HVAC systems, number one, and we're ensuring that we're cleaning the filters more often than normal. We are also, there's a component that allows us to bring in more fresh air. So we have maxed out on the fresh air component. We have actually put, and it may not seem a lot, but when you're talking about HVAC system, especially during the summer, we're actually pulling in the maximum 20% fresh air into our system. So we're changing the air out quite frequently. So we're starting with that, and then we'll continue to assess. We're assessing all of the ventilation systems currently.
Okay, thank you. And then I'll just ask one more and then I'll share that the other board members can have an opportunity. How often during the day are we cleaning bathrooms? And is anybody kind of monitoring the cleaning of buses? I mean, I know most people will do it, but how are we overseeing that?
I'm glad you asked that as well. We actually have brought some people from our night crew to work during the day, and bathrooms, just like say in airports, are being cleaned at least every half an hour, as well as the water spigots and the water refilling stations. In talking to Sam Gonzalez, our Director of Transportation, he will be monitoring that as well when they come back to the site. And then we have bought systems that allow us to clean a classroom or a bus very quickly. So they'll be using those type of cleaning methods.
Thank you.
They'll
That's
be
all
able to
for
do
now.
that. They'll be able to do that each time they come back to the barn, the bus barn.
Okay. Thank you, Mr. McDonald.
Thank you.
Does anybody else have a question? Michelle and Andreas. Okay, Michelle, then Andreas.
Thank you. Can you hear me?
Yes, Mrs. L.
Good, I'm glad. I looked at the classroom layout that you had for social distancing, and that's fine for maybe an English classroom, social study, but how about those classes that don't follow that? Your band classes, your choral classes, your drama classes, how are people going to be, students going to be kept safe in PE locker rooms? How are you setting up some of those other areas?
That is a great question, Mrs. Elm. Thank you. Those areas are great because they're so much bigger for us to use. So our band areas, probably about 4 times the size of a normal classroom. So when we get into our scenarios, we're going to talk about how many students we may be bringing back in phases. So if we brought back, say, a quarter, we may be looking at 7 to 9 students in the class at a time. And I know the APAs are really working very carefully to look at alphabetically how many students we would bring back, basically by alphabet, to have approximately, in one case, 25%, or how about 50%. And then we'll set up the classroom according to that phase. And so in the case where we only need 8 to 10 desks, we would do that accordingly. Same thing with your PE locker rooms. There will be certain lockers that will be able to be used on certain days, and we would set that up where, say, this is Monday lockers, and we would set those up socially distanced, staying away from each other, and then Tuesday lockers would do the same.
And my other question then is, if a student prepares to get on the bus and they have forgotten their mask, will the drivers have available masks to give out? And the same at the door of classrooms? Will there be extras? Because I can foresee people forgetting.
Absolutely, there are extras, and we're actually, with all the donations that we currently have about 30,000 cloth masks to be able to give to our students and staff that can not have one. So multiple, if you wish. And so, yes, we'll have those at our entrances and transportation, and no problem. We'll be able to help support with the PPE.
And one last question, and then I'll let Andres go. How are we going to keep them from social distancing? The first thing they're going to want to do is run up and see their friend, bump elbows, bump fists, all of that. I just see that as a terribly difficult thing to enforce. And it's not something I want to put back on our teachers.
I think that's a great question as well. And it's going to be just about as hard as keeping adults away from each other. It takes time, one, and it also takes, we have to be strategic about it. And so part of what we want to make sure that we're doing is be able to train and teach our students why it's going to be important. I will tell you, in our phase system for athletics, our student athletes are doing an unbelievable job when it comes to social distancing and doing the right thing. And I believe that we'll be able to do the same thing when we bring in small groups to the school, where we actually train, bring them through the routines, walk them through what social distancing would be, the mask, the different mitigation factors, the routes, the one-way routes, giving them maps so they understand really what we're doing in order to keep them safe. I do think it would be a little bit more challenging in elementary and middle school, but our first impressions of being able to do the phased athletic programs and activities has been very successful, and I think it will continue.
And I'm sorry, Andres, I have just one more, and then I'll let you go. How much time do you think the screening is going to take? If you're asking every student 3 questions, you're taking everybody's temperature, you're checking for those who don't have masks, has anyone put that time into their schedule so they're not losing instructional time standing at the door?
Not as of yet. I think they are considering that. What we are considering is ways to make it a little quicker. So the 3 questions are going to be electronic. We'll either use our Raptor system that allows the student just to put in a student number, the 3 questions, and they're done. Or we're using a QR code, which goes to a Google Doc that asks 3 questions, and then they're done as well. So we feel good about that. I know that Mr. Riley, the Director of Purchasing, is looking into other options for us taking temperatures at a quicker response. And then the principals are working very hard, and they've already identified the entry points in their schools, and they'll have multiple people there assisting their students so they can get into class on time.
Thank you, Mr. McDonald.
Thank you very much.
Mr. Barraza?
Good evening, everyone. Michelle, take all the time you need with the questions. I actually enjoy, the insight. So, and I think the community values it a lot as well. So, as much time as you always need. It's great to see everyone. Hope everyone's doing well. Let's see, Mr. McDonald, I just have a couple of questions for now, but I have more later, but wait for the end of the presentation. I'm sure you'll answer most of them. In terms of, well, the PPE, in terms of the neck gaiters, I don't think the neck gaiters are the issue. I think it's more the material use. Are we looking at the material use of masks in terms of what is more, I guess, what's more productive than other materials, and encouraging that? Is that something that?
The fun part, my wife would laugh about that I find this fun because it's always constantly changing. So when we're looking at masks, one of the biggest factor is the fit of that mask. And, the masks that we've gotten are all appropriate to the CDC guidelines. So that's a good piece. The other part is going to be exactly that. What are the masks made of, and how many plies, if you wish, how many layers? And then what we're also looking at, we talk about cloth masks, but do they have like another like a spandex or something in there that allows that fit to even be better? And so we are working with the AIA and getting some direction about gaiters, because that would be easier for our student athletes to use. But those are the big pieces right now. It's really about what they're made from, the amount of layers, and then also can they have a filter put into them or not, and then also the fit.
I appreciate that. That's one of the things I was thinking of, is the practicality of the gaiters and being able to utilize them. And it seems that it's more about the material. So, but in the end, I'm encouraging any use. Any use is positive, and
any use of face coverings is better than no face covering.
Absolutely. So, I'm not going to pick on that one. I think it's a positive step for everyone. So, yeah, whatever students can utilize in the end. As far as, looking at sanitation in the restrooms, where we're looking at, I think I've been advocating for waterless or reduced water systems like urinals and so forth in the bathrooms. Is there an opportunity for us to possibly, and this one just came out of the blue, this question, so you may not be prepared for it and you may have to get back to me, but is there an opportunity for any of the federal money to go into that into creating installing touchless sinks that are reduced water, urinals that are reduced water use that don't touch, ways that we can be mindful of the environment while we're also thinking about PPE.
When working with the Department of Military Affairs, DEMA, and FEMA, they're really looking at reimbursing PPE safety pieces, not necessarily water usage and things of that nature. So the things that are being successful, the mask, of course, are being reimbursed, and sanitation, disinfecting solutions. I'll look into that a little bit more, but at this point, I don't believe that DEMA will find that as a qualifying reimbursement.
I want to respond to that to Board Member Barraza and members of the board, because that's a great question, and that's been one of the concerns that we have expressed on a broader perspective as districts, because to have those health mitigation reef configuration pieces we really help out in those areas, and they're costly. And so while we're very appreciative of the reimbursement opportunities that we will get from FEMA and DEMA and some of the donations that have been provided to us from other agencies, it's not going to cover nearly all of the costs that we are incurring as a district to open up safely and to make sure that our students and staff are safe when we finally do reopen. We impress upon the state level with our governor and as a cohort of superintendents, if you will, because that's the piece. It's got to be properly funded, and we'll keep pressing on that because that's an important issue. Thank you.
I really appreciate that, Dr. Manuel and Mr. McDonald. If you guys can continue advocating for things like touchless sinks, I think it's not only necessary at the moment, but it's a way of utilizing the dollars to add value to our district, to our individual schools, while also doing the right thing. I think what I'm concerned ultimately is the likeliness that we will probably have to put hand wash stations and so forth around the campuses when those are temporary and we should be adding value. So if you guys can continue advocating for those, maybe for the funding, or at least to adjust the dollars to give us some flexibility, I think it'd be great. I think it'd be a great way to take care of the environment while also being responsible and encouraging, hygiene. Let's see, as far as the transportation, I have just a request in terms of our buses. I was thinking, well, we may need to have the windows open, to encourage proper ventilation. But then I started thinking extreme heats, and coming into the fall and winter, extreme cold temperatures. And so the practicality of that is not possible. However, we do need ventilation. Is there any way we can encourage drivers or put in some type of policy that says they need to run the vent to pull in outside air and push it out, regardless if we need the heating or cooling, so that way the air is not circulating among students, but at least being drafted out in some respect?
Thank you for the question, Mr. Barraza. Yes, I'll work with Mr. Gonzalez to discuss that, just like we're doing with our HVAC systems of pulling in that extra air and changing out the air off, and we'll do the same with the buses.
I appreciate that. I have a lot more questions, but just one more for now. Quick one is there any flexibility, do we know of, for the federal food program in terms of being able to work with their local farmers, producers, distributors, and so forth, like Safeway, Bashes, Fry's, to be able to have more flexibility with our lunch program?
I honestly don't have the answer to that question, Mr. Barraza, but I'll be happy to work with Julie in the nutrition department to get that back to you.
I appreciate that. That'd be great if we can, be able to work with our local producers, distributors and so forth, to be able to get our children, really good, satisfying lunches, and take off the weight that I think our cafeteria staff is going to be faced with during this period in time. I think there's going to be a growing pain situation where the meals are going to have to prepared very differently. So also just in the aspect of, let's take advantage of that if that's an opportunity to. But that's all I have in terms of questions for right now. Thank you.
Thank you, sir.
Thank you, Board Member Barraza. Vice President Garcia.
Thanks so much, Madam President. And thank you all so much for putting this together for us and for the community. I really appreciate it. There's a lot of information out there, so I hope we're able to comb through all of our questions. Really quick, I want to thank Michelle Helm for touching on enforcement and the timing on screening, because I think that's really critical, especially because I personally don't want to run into instructional time because we're already in a tight bind. But with respect to compliance, in a scenario that, let's say, anyone who's on campus that does not want to wear a mask, what steps does each school site will take, etc.?
We'll be happy to work with each student requesting that, and of course talking to the parents of that student. If that behavior continues to manifest, we will ask the parents and student to work virtually from home. We need to ensure that the mask policy is that we're wearing our masks, that we're doing it. And when we wear masks, we need to remember we're not necessarily wearing it for ourselves, we're wearing it for others. And we will support the administration with that policy.
I want to, Board Member Vice President Garcia, I'm like, the other piece is, and probably equally important, is that as a board and through the governor's executive order, we were required to have policy regulation around face coverings in a situation like this as a pandemic. And so I think either last week or several board meetings ago, that was developed, and so we approved that as a regulation. So that is part of our policy, that students and teachers will be required to wear face coverings. And of course, we have those student and even adult, for students, there may be some medical or reasons that would be allow them not to wear the masks, and you have to be careful and that kind of a thing. But so the other option is if we're trying to open up safely for everybody, and so we can't have folks coming on board saying we're not going to be wearing masks because, as was mentioned by Mr. McDonald, you're not wearing a mask is saying that you value the life and the health and of somebody else. And so that's what we're all trying to do so that we remain open. The other option is that those individuals who have that sentiment that masks aren't important or required, then you just continue in the virtual format, and that's perfectly appropriate. For our staff, our teachers and staff, that is not an option, and I'll explain with what we will be doing with that, because that has to be crystal clear, and I think Mr. McDonald said this well, and I'll keep it kind of short as I can, that it's imperative that we all understand our role with the mitigation plan, the health mitigation plan. And if we have teachers and staff that are a little lackadaisical, if you will, in the protocol, there's where we have holes in the system. And so employees will be held accountable to that policy as well, And so if that is the case, I have every intention next week to be releasing a message from me as the superintendent along the line of, here's the importance of the protocol, the health mitigation plan, all of that. Everyone needs to do their part. And that is going to be the employee warning, quite frankly. If that's a deliberate kind of thing where folks are choosing or not taking it very seriously, then there'll be other disciplinary consequences for that employee. I can't impress upon how important this is that we all take it very seriously.
Well, thanks so much, Dr. Mandeville and Mr. McDonald. With respect to in the event that we have an outbreak, what does quarantine localization look like? So is it scoped to obviously the contact tracing, or is it localized to a school that would to maintain an outbreak?
If we're looking at a one-off positive case, we will start internally with the district operations and the site contact tracer to help support that. Once we recognize that there may be another case that is not related, that is then an outbreak, and we need to get the health department on board to help support that.
Okay, thank you so much. And then I have one request. I think with the increase of social emotional needs, I think it'd be helpful for, as a board, to go through a similar training. Would that be possible for us to go through, just so we're aware and up to date with what the same trainings that our teachers and staff go through?
Actually, I would love to require it for you, since you're going to be around our students. We'll give you that same information that the teachers and classified staff get. Thank you for wanting to do that.
Yeah.
It will only be about an hour and 15 minutes for you.
That's fine with me.
All right. Well, thank you guys. I will just the sake of time to keep it going, I'll just email my questions. So go ahead. You can go ahead with the presentation.
Thank you, President Hodge. And I just like, before I leave the health mitigation plan, Dr. Mendeville's right. This only works if all of us are living it, modeling it, and enforcing it. So we'll go ahead and move on to component 2. And this is the level of community spread and the metrics. The important part about this is we're working not only with the Arizona Department of Health Services, but also the Maricopa County to make sure that for us to get to benchmarks that fall within the moderate and minimal spread categories, we need all 3 benchmarks to be met for 2 consecutive weeks in order to provide this hybrid learning. And the hybrid learning model will be some students in physical buildings and some students distant learning. As Dr. Mendeville spoke a little bit about in the beginning, there are considerations for viewing the benchmark data. So we have case rates and number of cases. So you'll notice that benchmark 1 is broken into 1A and 1B, 2 metrics in this benchmark. 1A is decline in weekly average cases for 2 consecutive weeks. Technically, that is a pretty easy metric to meet. So I'll give you an example. At our highest rate, just before we were required to wear a mask, once we started to wear masks, we started to see a decline. That decline per cases per 100,000 could have been as high as 400, 300, 200 cases, but it never dipped below the 100 cases. So in that case, 1A could have been met very easily. 1B is case rates 100. It has to be below 100 cases per 100,000 population for 2 consecutive weeks. Now, the Maricopa County Department of Public Health recommends using case rates, not necessarily just decline. So we as a district are going to take that recommendation, and for us to meet the benchmark number 1, we will be using benchmark 1B because it allows the district to evaluate the spread of disease in our area, and the case rate will be more accurate, reflected when it is happening in our community for our population size. And depending upon where we are in our district, we have very heavy populations and we have light populations or low populations. And so just to summarize again, we will be using 1B because you could use 1A or 1B, but we're going to take the recommendation from Maricopa County. The second benchmark is percent positivity. And the Maricopa County Department of Health says that we should be putting our greatest weight on the PCR test percentage of positivity. Now, PCR is polymerase chain reaction. Basically, it's the COVID-19 test that tells you if you're positive or negative for COVID-19. This is going to be a very important piece. The higher the positivity can mean the more disease spread within your community, or it can mean that there is not enough available testing in your area. The benchmark for percent positivity for moderate spread, and I think this is going to be important, we have to be between 5 to 10% for moderate spread just to get into the hybrid model. The recommendation is therefore to make sure that we're in that less than 7% positivity for 2 weeks in order to move from virtual to hybrid. This will be able to allow us to provide the evidence to our community that our community spread has decreased and that our testing is more available. And then, of course, the third benchmark is COVID-like illnesses percentage for the hospital visits. And what we need to be with this one is that we need to be at 10% or lower. So every visit that the emergency room sees will be, and that says that, or a hospital visit will be, those symptoms of COVID-19 will count. And so this will be very interesting. The first signal is we see a decrease or an increase in that community spread in the hospitals. Currently, we're seeing a decrease, and we'll see that that decrease is all the way down to 3% currently. This is a visual that you can see on the Arizona Department of Health Services. And again, it just speaks to what we just spoke of as far as the cases, as far as the percent positivity and the COVID-like illnesses. If you were to look at the Arizona Department of Health Safety website, you would see these benchmarks. And you'll notice right there, this was for last week. These come out on Thursday, or updated every Thursday. And you'll see that 1A met because it showed a decrease for 2 consecutive weeks. 1B did not meet because it was still at above 100 for 2 consecutive weeks. 2 did not meet because the percent positivity was still at 8.7%. And then 3 did meet because you'll notice that it went below the 10% barrier for hospital visits. The CDC will also talk about community spread as the following. So when we look at these tables that we'll show you, you'll either see minimal spread, a moderate spread, or a substantial spread. And they'll be corresponding to these colors. So when you look at the benchmarks, the cases per 100,000, a minimal spread needs to be below 10 cases per 100,000. A moderate will be between 10 and 100 cases per 100,000 in population. And a substantial will be greater than 100 cases per 100,000. Percent positivity, in order to get to the minimal, and again, that will correspond to all students back, we need to be below 5%. Moderate needs to be between 5 and 10%. And currently, they're going to say below 7%. And then substantial is greater than 10%. And then the COVID-like illnesses having to do with hospital visits, and the minimal needs to be below 5%, moderate 5 to 10%, and substantial needs to be would be a greater than 10%. So when we get into the Arizona Department of Health Services and we look at the statewide metrics for benchmark 1, you'll notice here 3 dates, and how the state does that is that you'll be in your current week. You do not count your current week, and you back up 2 weeks prior to that. So you'll see that our latest numbers are from August 2nd because they want to make sure they have accurate data. Tomorrow you'll see the data for August 9th. Benchmark 1A, as you can see, went down, showed a decline from 274, 206 to 84. Benchmark 1A was met for 2 consecutive weeks, in this case, 3 consecutive weeks. Benchmark 1B, you'll notice is not met yet. However, we're trending in the right direction. So when we see 274, 206, then 84, we have met benchmark 1B only for 1 week. And remember, we have to show that for 2 weeks. But my guess is tomorrow, that number will probably show green. And so my guess is benchmark 1B may be met with tomorrow's data. be interesting to find. As we look at benchmark 2, we're showing, again, we want to see 2 consecutive weeks with the percentage of positivity below 7%. And unfortunately, statewide in Arizona, we're not seeing that yet. We had a 12.2% and it went all the way down to 8.8. My guess is that it will still be a couple weeks till that gets down to the 7% threshold. But we don't know. So we'll continue to watch weekly and make sure that we're looking at the data on a regular basis. When you look at benchmark 3, the hospitals are definitely seeing lower cases, percentages coming in, and they're all the way down to 2.1. So benchmark 3 has been met at this time, being below 10% for 2 consecutive weeks. Now, when we look at the Arizona Department of Health Services and we change from statewide, we're going to look at just the county of Maricopa at this point. And so benchmark 1, once again, has showed a decline, and in fact showed a bigger decline, 50 to 100,000, 50 cases that is. 1A has been met for 2 consecutive weeks. 1B, again, Maricopa County is showing better than the statewide. And so as August 2nd, we were at 50 cases per 100,000. Again, my guess tomorrow is that August 9th will show a green in that category, and we will make that benchmark. We'll keep a careful eye on that as well. When we look at benchmark 2, Maricopa County actually in percent positivity has trended up over the state. So where the state was 8.8%, we are now here at 7.4%. And so we haven't met that for 1 or even 2 consecutive weeks below the positivity level of 7%. Therefore, benchmark 2 has not been met. And just a reminder, we need to meet all of these benchmarks in order to go into the hybrid model. Benchmark 3, again, hospitals are definitely seeing lower groups coming into the hospital, 2.4%, and benchmark 3 was met for Maricopa County. So this is Tempe Union High School District boundaries. Now we do know that that is our internal boundaries. We do have students that come from outside of our boundaries. So I'll show you the information for Tempe Union, and then I like to break it down by in-boundary zip codes and outside the boundary zip codes to show you what's going on in our different communities and how they could impact our schools. So when we look at the Maricopa County Department of Public Health dashboard and look at Tempe Union, you'll see, and Maricopa County does actual real-time dates. So tomorrow, again, I believe after 4 o'clock, they will update this again for August 27th. Last week, I reported during the board meeting a substantial overall risk with a recommendation of virtual. Thankfully, we are improving. So as we look at our cases per 100,000, we have gone from 127 to 72 all the way down to 45.99. When we look at our percent positivity, we're trending in the right area as well. So remember, the yellow area is between 5 and 10. And when we look at August 20th, 5.95%. So we're trending definitely in the right direction, that getting below 7%. And then our COVID-like incidents for Maricopa, you will see that we went from 7 to 4 to 3 on every one of these slides. So Maricopa County and the hospitals are trending in the right direction, and we actually have met that benchmark, and we are green. As we look at boundaries inside or zip codes inside of our boundaries, we look at 85281. We're doing actually very well. It shows us that our overall risk is moderate, that we can go into or look to transition into the learning scenario of hybrid. Our cases per 100,000 people could continue on the decline, about 50 cases per 100,000 people. Percent positivity is 5.74%, which is below the 7% threshold, but it's not below the 5% threshold for it to be green yet. And then, of course, our COVID-like illnesses, again, 4 and 3. When we look at 85282, 85281 is again the ASU area, same here. Tempe High, if you want to know our high schools. 85282 can impact McClintock, a little bit of Tempe High and Marcos as well. Overall risk is still in substantial area. They're still speaking that that area should work with a virtual on-site support. Again, trending in the right direction as far as cases per 100,000. What we didn't meet here is we only met the percent positivity for 1 week. It was 11% last week. We want to be between 5 and 10 or below 5 to be green, as it is here, 4.55%. When we look at 85283, we're moving in the right direction again, week to week, going down. Interesting about 85283 is that our percent positivity went back up. So that is the trend that we're looking at, from 5.48% up to 8.97%. And if that goes again back up past 10%, we'll be back in the red. And so these are the things that we need to monitor on a weekly basis, and then find out why that is happening, or at least do some thoughts about why that's happening. If we look at 85284, again, our Corona area, moderate to high, with the hybrid learning scenario, really great cases, not quite below 10% yet for it to be green, but 15 cases per 100,000. The percent positivity at 85284 is 0.00%. And again, the hospitals are about 3%. So very encouraging, trending in the right direction. As we look at our Mountain Point area, 85044, both Ahwatukee going to Mountain Point and Desert Vista. We're looking at moderate hybrid with 33 cases per 100,000. Percent positivity did go up a little bit there, so we're watching any trends that tend to go up as opposed to down. And that could be that we're seeing more cases. We just want to understand what we're looking at. So we'll monitor this tomorrow, and I would be happy to send that out to you in an email as well. When we look at 85048, again, Desert Vista, a little bit Mountain Point. Again, moderate to hybrid areas with 36 cases per 100K, 100,000. Our percent positivity is in the green here because we're below 5%. So again, I'm pleased that we're trending in the right direction and that our communities are taking good care of themselves, following the mitigation factors. When we look at the Corona areas, is Chandler 85226. Good portion of the students come from that area. We're looking at moderate to hybrid learning scenarios, 35 cases per 100,000. Again, trending in the right percent positivity. From 8 went down to 4.5, so it's green because it's below 5%. And again, the hospitals are the same. When we look outside of the Tempe Union boundaries, so 85040, that is our Phoenix area. We get students, especially from Tempe High, from Mountain Point from this location. Very substantial. Virtual is the learning scenario. My worry here is the case number, 114, although it is trending downward from 280. 114, remember, greater than 100 per 100,000 is in the substantial range. And then the percent positivity, we want at least between 5 to 10 and below 7%, of course, percentage to get to a hybrid setting. This is definitely a little bothersome as we share approximately 440 students from this zip code. 85041, again, is South Mountain area, substantial with a virtual learning scenario. The good thing is we're trending in the right direction. Cases, again, 97 cases per 100,000, down from 230. Percent positivity is going down, but it's still well above the threshold at 15%. And so we will continue to look from here. We get approximately 250 students from this zip code area. 85042, again, Phoenix. This is the baseline corridor area, can impact Mountain Point, Tempe High, Marcos, McClintock. Again, substantial, virtual, however, going in the right direction. You'll notice in this area, 86 cases per 100,000. We are below the 10%, but we're not below the 7% threshold. So we want to continue to look at the percent positivity for 85042. And we have about 610 students that come from this area. When we look at the Maricopa or Pinal County, the city of Maricopa, we have many students that come from there. They have not actually met benchmark 1 because there hasn't been a decline. It went from 98, 97, 98. So they're still not meeting benchmark 1A, but they did meet benchmark 1B, being below 100 cases per 100,000. So that is a good place for them to be. We are continuing to see the same trend with percent positivity. A little worrisome that we see sometimes numbers go from 9.9 and then up and then back down. It will be interesting to see how this tracks. Sometimes we see that rhythm of up and down quite often. So we want to be careful for that. And of course, Pinal County areas, the zip codes of 85138, 85139, the hospitals have met benchmark number 3. So that is the component 2, and I'll answer any questions that you might have about the metrics.
Okay, I see Mrs. Loud and I see Mrs. Hem.
Thank you. Hey, Mr. McDonald and everyone that worked on this, thank you for all your work on it. I know this takes time and appreciate it. And I appreciate our families and our teachers' patience with this, because there's no right answer here. That's the most frustrating thing about this. And, you know, it's a lot of patience. So I appreciate that. So I have 3 questions. First of all, when we finally decide to open, are we opening as a district? And if we are you going to look at the district metrics and ignore the zip codes, or how will those stats be kind of intermingled to make a decision?
Dr. Mendenville, would you like me to do that first, or would you like to do these?
Well, thank you, Board Member Lau, and the rest of the governing board. That's a great question, and it's one that's not easy to answer, but what we can say is that we have to be inclusive of all pieces of data. And the reality is we are an open enrolled state, and we have members of our community that may not fall or reside in the city of Tempe in those 4 zip codes, but they're just as much as Tempe Union students and families, and have been for a long time. For both us, Kyrene, we share a lot of the same areas because we do accept students by law for open enrollment because we have space in our schools. So that's one of the reasons why I asked Mr. McDonald to include those zip codes where we receive the most students. I can tell you that those districts that have within their boundaries, but everyone's open enrolled, Scottsdale is a good example. They're factoring in those zip codes that comprise a good chunk of their student body. We need to have greater discussion among the principals around this and see how this could look logistically for a plan. So right now, it's important that we take into consideration those zip codes that are outside our boundaries when we're factoring in a phased plan.
So what I hope,
Oh,
yeah, go ahead.
No, go ahead.
So what I hope we'll have to figure out how we're going to weight that so we can tell our families and teachers so they have an idea how we're calculating whether we're going to open or not. So I would request that as soon as we can kind of figure that out, how we're going to do it. But also I'll just combine my other two questions and requests. Can we, on a weekly basis, at the very least, have our principals include an update to all our families and teachers where we're at, and possibly give some estimates of a date that we see we're going to open for planning purposes? Because I know everybody is anxious for that magic date, and we may have kind of an estimate in our mind. And I think we can clearly say that as long as we're very explicit in saying, you know, it's an estimate at this point.
Thank you for saying that, Ms. Lau. The intent after actually tomorrow, when we get the next piece of data that's most current, our plan, and I've talked with Megan, our executive director for community relations, and we have we'll have a space on the website as we do right now, and that piece will be included so that families can have the most up-to-date status and data on that. We can, you know, if the data continues to trend in the right direction, you know, we can throw a dart and say, all right, the end of September or something like that. It's going to be dependent upon the metrics as we move forward, and every district is saying that that they're dependent upon the data that's available to us today, and we will be doing the same thing. So as soon as we have an idea, with the reassurance, because actually it's not so much the metrics for me as superintendent as it is for how well we're understanding and implementing the health mitigation protocol at all our sites. That's going to be the key, because opening is one thing in a hybrid model, you know, because we're going to be cautious and safe about that. But I don't want to be in a position where our employees did not take this seriously enough, where we have to restrict ourselves and go back into a virtual mode of any sort. And so I want to be able to open with a greater level of confidence that we will remain open and be cautious, and because what we're doing is practicing new behaviors. Our teachers, our employees, we're starting school, and we've got to practice new behaviors. And that sounds very elementary, and that's part of my background, but that is the reality. Everyone has to start practicing these new behaviors that are really important for us to remain open. So
That's fine. And then one final request. I think our families and teachers would like to know what hybrid means to them. So as soon as we can explain that, at least get it out on our website and maybe in a communication. Does that mean 1 day a week, 4 days a week, or has that changed? So I think we really need to define that as quickly as possible for our families and teachers, and so they know what we're looking at.
Thank you, Mrs. Lau. I will tell you that some of these dashboards we've just got, the Maricopa dashboard is less than 2 weeks old, and so we're looking forward to getting the data tomorrow and give us an idea of what's trending, and we'll be able to have some more questions or answers tomorrow for you as well.
Thank you so much, Mrs. Ham.
Well, Mrs. Lau asked the two questions I had listed as wanting to add, and one was about the zip codes, and the other was about a hybrid. But I'm going to take her question on zip codes one step further. If we see a zip code or two that would indicate that we could open, would we think of opening that 1 or 2 schools, or are we waiting for the entire district to be clear before we open any schools? I'm sorry, I hope I didn't put you on the spot.
I'm sorry, Board Member Helm, thank you for the question. I'll answer it for what I know right now today, this very minute. Again, I would go back to, we need to look at all the entire picture. And so if there is a region, because I use this term cross-pollination. And when you talk about COVID-19, you're cross-pollinating, okay? And that's what it is when you have an open enrolled, open boundaries, if you will, in the state of Arizona, because that's how we function. And so while we have a target idea of kids coming from particular communities and that are maybe different from our boundaries, that's the piece that we need a little bit more time to hone in on and figure out, okay, what are going to be the implications? If we have a particular school that is lightly implicated in terms of cross-pollination, those are some factors that we need to talk about. I also have to factor in, okay, our teachers talk, employees talk. Why do I have to start and you guys can remain virtual? So those are some couching of discussions and understanding, because ultimately what we want to do is make the best and safest decision on behalf of our students. That may look a little different with one school versus another, but ultimately we want to get to that same point.
Okay, thank you. And then on the hybrid, I too, I know Mrs. Lau said something about parents need to know and teachers need to know. They certainly do. And every district seems to be calling hybrid something different. And it's not like the entire state is following the same format for it. And I would like to know where we're going to go with hybrid too. Is it going to be the 1 day a week at some schools, the 2 days a week that we talked about way back in March? Is it going to be morning classes, afternoon classes, maybe evening classes? There are just so many choices out there that I too think our staff and our parents and our students need to have ideas of what we're looking toward. And maybe there would even be, I know everybody hates the word survey, but maybe there would even be a way we could ask who's available for nighttime classes, who's available for morning, this type of information that maybe would help you make this decision on hybrid.
Mrs. Helm and Mrs. Lau, in my next section, I'm going to give you a couple examples of what hybrid may look like for the district and may answer some of your questions. And then the other thing in regards to the zip code, I just wanted to share, Maricopa County allows us to look at our schools, especially if they draw from students in different area border boundaries than the district boundaries. And what we're going to be able to do is take those zip codes, be able to find a region and do an average of the case rates between those. So it could be that even though we have students coming from different schools, depending upon the population of those schools, especially coming from outside the boundaries, we'll be able to average the case rates and be able to use that data.
Thank you.
Thank you so much, Mrs. Helm. Board Member Barraza.
Yes, I just have a brief question just pertaining to the boundaries. I can already foresee that ASU is going to screw us up. I just don't see the student population being responsible in that aspect of not going out. We're already seeing cases increase in the ASU area. If we're doing it by zip code, then reasonably we can assume that Tempe High, McClintock High are going to be shut down for longer period of time than maybe our southern schools. However, that's not necessarily the case because ASU students live in Ahwatukee, so we may actually have, the whole district or, portions of the district. I guess my concern is looking at all of those factors, we really need the governor to put in the emphasis in our education system, in our public schools, because we need testing. I don't see how we're going to be able to open up and stay green for months. We're going to stay green for a week, then we're going to shut down and we're going to yo-yo back and forth. So I think we need testing so that way when we hit those moderate areas, there we have a possibility of telling students, if you go get tested, bring us your, test results within 48 hours so you can come back to campus. I would hate to see student athletes students doing theater, music, needlessly having to sit out when they can get a test and potentially come back on campus. Is there anything in right now regarding the ability from the state to provide us any funding, or the county for testing or anything of the like?
Mr. Barraza, we do have lots of relationships that there are a lot of communities that can offer free testing to our students. We can't necessarily require it, but we can give them the information if they want to go do that at a no cost to them. What they would have to do, though, is after an exposure, CDC does require the student or staff member to stay out and get tested 4 to 5 days after the exposure. Or if they're already having symptoms, they can get that testing immediately. But we do have some community areas that will allow free testing for our students and staff.
Okay, so I just want to make sure that we can encourage testing, because I already see, we're going to have athletes, maybe they're part of one cohort, and they're going to have to stay home and they're going to miss the game, or they're not going to be able to play or do their theater presentation, dances, all different aspects. People are going to miss out needlessly. So that's we
can encourage it. We can't require it.
No, I'm not worried about requiring it, but if we can let students know, if you do go get testing and you bring back the results within 48 hours and you're negative, we will allow you back on campus. I'm just worried about, let's say the students in a cohort and they're going to be performing on Friday, but they're told last week's Friday that their cohort's supposed to be staying home. While they feel fine, could they go get a test over the weekend, present it Monday, and then be able to be a part of that play or be a part of that activity?
They would, Mr. Barraza, they would have to wait the amount of days from exposure. So if they were exposed, unfortunately, they have to wait 4 to 5 days before they can be tested.
Okay, I just want to make sure, because I think that's going to be something that the students and parents are going to really want to know, is how, when, and what, programs, when we start rolling things out. It's going to be tough, but let's just see how it goes, I guess. But if we can figure out a way that we can clear students, I think that would be helpful to ensure that they're staying in classes. Also, I know we're going to go over, the curriculum and so forth, but if we can really hammer in, being able to utilize our classroom time for activities, labs, art. I really would hate if students came to classes to just sit and learn algebra, when I feel like they really need more interaction with their teachers and the ability to do something different. That is also related. Are students going to be asked to come in to do English essays, or is that something that we can, do it online while having the students come on campus to do more hands-on stuff?
Well, I'm a board member, but I'm going to answer it this way. We're going to rely on the teachers to have a continuation of their syllabus and their coursework, and I can just naturally, you can be more interactive with students when they're there. So it's built in kind of naturally with what they would. I'm positive they're going to be wanting to get more involved with the kids once they're in there, and then there's going to be a segment at home eventually too. So how we coordinate and work those as we look into a phased approach. So and there's a variety of ways. Like art will still happen, just with social distancing, with the mask on. All those pieces have to. Those are the key mitigating pieces that will happen for regular instruction. And so nothing really should change as much. I mean, we want to encourage that social activity and interaction with students, but just do it safely and in a different way. And I mentioned this before. They're new behaviors. Everyone's going to have to learn new behaviors right now, and our kids are smart. We're all good. They'll learn quickly because they want to be there, and we want them there.
And I guess the last question I just have is, in terms of going from green to yellow, how quickly are we shutting down?
Can you repeat that question, Mr. Barraza, from green to yellow or yellow to green?
Well, if we're in the green and we have classes that are open, and then next week we have data that says we went into the moderate status or severe on one or the other, how quickly are we closing down? Are we looking at a week's long of red, or are we saying one is enough, or some type of range?
Yep. Thank you for that question, Mr. Barraza. What we need to do is work with our health department right away to find out how serious the situation is, and then we also have to look at not only that area, but also the zip codes and the county, make sure that we're looking at all of our data sources. Because like you said, there might be a situation where it is a situation where maybe it's at the ASU area as opposed to maybe right in our area. So we need to look at all factors when it comes to that. We will work with the health department when it comes to closures, though, or even going backwards if you would like to a virtual model or intermittent model.
The next part.
That's all the questions I have for now. I know we're going to run into information regarding staff, so I'll hold my questions till then.
Okay, Mr. McDonald, you can continue on with the.
Thank you. This
Next
will be
part.
our last section here. So how is it that we're going to try to reopen, or some opportunities to reopen Tempe schools, Tempe Union High School District? This is scenario 1 through 4. And so we're given 4 scenarios for schools to reopen. We will continue to follow the local health guidelines and the requirements outlined by the state and local officials. This is very important. Scenario 1 is a traditional model, and that's what we've always been used to, all students in physical buildings during the school day. Scenario 2 is a hybrid model, some students in the physical buildings and some students distant. Scenario 3 is virtual. That's currently where we're at, all students distant learning from the start of the school year with on-site support. Scenario 4 is an intermittent stage, which allows us to flow backwards and forwards depending upon what we're seeing based on emergency closures, which is the question that Mr. Barraza asked, defined by our local and state health departments. And so we have to work with that group to help determine which way we need to go. As far as community spread levels, this is a very important table because we're looking at intermittent virtual. Technically, at virtual, we don't need any scenarios. We don't necessarily need to talk about hand hygiene or enhanced cleaning, proper ventilation at the school setting. Once we get to hybrid, we will need to follow all of those mitigating factors. Of course, the proper ventilation, the monitoring absences, the screening, the physical distance. And the good thing, this is very important, as long as you stay in the hybrid, we need to continue the mitigating factors. It's once we get into traditional that you'll see 6 of those mitigating factors fall off the table. And those are screening symptoms, physical distance, cloth face coverings, cohorts. Field trips would be able to happen again, and communal spaces would be open again. So we would like to continue to look at that hybrid model and see if there's phases within that hybrid model that can help support, of course, the safety and welfare of our staff and students. So when we have to use our benchmarks to inform reopening, and this is a checklist that we need to make sure we're doing. So we need to make sure that we're following before we go into in-person instruction or opening our buildings. We have to be consistent with the application of state and local orders by the governor. We need to make sure we are consulting the local health department to confirm 3 benchmarks, to make sure they're in the minimal or moderate guidelines. The district and the local health departments will also use different or other considerations, perhaps, as we look to reopen our schools. Of course, we have the 3 benchmarks that have to be met just to go from virtual to our hybrid. We need to make sure we're below 100 cases per 100,000. Again, this is for a 2-week, consecutive 2-week decline. We need to make sure that our percent positivity is below 7% for 2 weeks. And we need to also make sure that our hospital visits stay below the 10%. We need to adopt this mitigating plan. We need to make sure that we include strategies for the scenarios. And the other thing is that we need to make sure that that this plan has been and is posted on our website. And what Dr. Mendenville said is so important. Not only this plan is adopted, but it's lived and everybody is doing it, because that's really what's going to be the case. If we can't live it and model it and enforce it, we're not going to be very successful in reopening our schools. So currently, as you know, we're in scenario 3, and we are preparing for a transition to scenario 2, which means a hybrid, which means some students in physical buildings and some students distant. Here are examples of 3 phases for scenario 2 consideration. Now, we could use all or some, depending upon maybe what site we're looking at or where we're going to route. Some prefer maybe going slow to ensure that we have the behaviors set with our kids so they understand how to come back. So in this case, phase 2A would be a cohorting model, as we spoke of earlier. In this case, students would be in person 1 day per week, Monday, Tuesday, Thursday, or Friday, with Wednesday being an asynchronous learning day, a deep cleaning day, and a PLC day. Phase 2, we can move to phase 2 or even start at phase 2. Could be a
2B.
cohorting. I'm
2B.
sorry, 2B, thank you, sir. 2B could be would be cohorting again, and students would move in person 2 days a week, either Monday, Tuesday, or Thursday, Friday. So if I was a student in 2A going on Monday, now I'm going on Monday and Tuesday. If I was a student that was in cohort 2A on Thursdays, now in 2B, I'm going Thursday and Friday. Again, with Wednesday being an asynchronous learning day, a deep cleaning day, which is very important to have this deep cleaning model. So the same cohort would go Monday, Tuesday. We'd be able to clean the entire school and disinfect it on Wednesday. And then Thursday, Friday, the next cohort would come in. In order to move to 2B, maybe to 2C, we would have students in person 4 days a week. So now we're cohorting everybody Monday, Tuesday, Thursday, Friday. Again, with Wednesday being an asynchronous learning, deep cleaning day, and PLC day. You may say, well, isn't that all students? And technically it's all students 4 days a week, but because we're still in a hybrid model, we can continue to do all the mitigating factors. So during 2C, we would still be social distancing as much as we could. We would still be wearing our masks. These are important pieces when it comes to the spread of COVID. So as we would move to this would be a visual of moving. So from scenario 3 virtual, in order to get to scenario 2, the state and county has said we have to be below 100 cases per 100,000 for a 2-week decline. We have to be below 7%, and we have to make sure that our hospital visits are 10% or below 10%. And at that point, we could move into scenario 2's phase A. From us to get to scenario phase A to phase B, we would look at cases that would be below 50 cases per 100,000 for a 2-week decline, percent positivity below 6%, and then COVID-like illnesses below 5%. And I think the important part here is you may ask, the state gave us the top one of 100 cases, but the 2 next ones we had to look at and say, what is the biomarkers we want to use in order to improve exposure assessment? And so in epidemiology studies, we use what we call half-lives. And so we're looking at the half-life from 100 cases to 50 cases, and the next one will show 25 cases. And so in order to get to phase B to phase C, we would look at less than 25 cases per 100,000. Again, this is all for a 2-week decline. Positivity, less than 5%, and COVID-like illness, less than 5%. And we would try to move these minimum of 2 weeks in each phase. Now, again, this is not necessarily, this is how we can move through this example. Again, we could look through different examples as well.
I'm going to comment real quick. Yeah,
Sure.
Okay.
Go ahead.
The advantage of any phased approach is that we are looking at the most cautious way in which we can return students and keep them in our schools. Okay, it's the most cautious phased approach so that we can reteach some new behaviors or teach new behaviors to our students and to our staff, our teachers and staff. So this is, we can do all of this successfully if we just moderate and we're patient as we move through a phased approach. I get concerned with some of our schools as large as they are that there's no way, unless we have this time to prep with our teachers and staff and practice together, I just get a little worried that all these efforts are going to be to not a positive outcome. And I want to make sure that everyone understands their role. I've now said that 4 times in the health mitigation plan, so that we can do this in a phased, successful approach. Because ultimately, we all want our students back at schools, but we want to do it in a safe manner and in a cautious manner, and so that everyone is feeling comfortable being at school. And that includes our teachers and staff, and most certainly our students.
Dr. Mendeville, thank you for sharing that. That's exactly right. And we know that the phase approach, even in our student athlete, the athletic program has been working. And so we agree that this would also work as a phase approach for our return to school. And then if we go to the last one here, if we're looking at scenario 2C, how is it that we get to scenario 1? And the state has recommended that in order to be from a scenario 2C, which would be, in that case, all students going Monday, Tuesday, Thursday and Friday, and then making sure we're using the mitigating factors, we have to be below 10 cases per 100,000 for a 2-week decline. We have to be below a negative or below 5% positivity rate and below 5% for our COVID-like illnesses in our hospital visits. And then we would be able to return to a traditional model of all students in a physical ability during this year. What Dr. Mendeville also said is that we have to be very careful, because depending upon if we move too fast, the metrics make it more or less restrictive. And unfortunately, we are seeing, even just recently in Mississippi, open too quickly, and they have already shut down and quarantined over 8,000 students and staff members. So we want to make sure we're doing this right and making sure that our students can continue to transition in a proper fashion. And so that completes the presentation, and I'll open it up for questions and answers.
Okay, Mrs. Helm?
Unmute yourself.
Mrs. Helm?
Yeah.
Oh, thank you. And thank you, Mr. McDonald and Mr. Mendeville. I don't mean my questions to be pushing at you, but maybe in a way they are. Looking at the examples that you've given us for phase 3 for consideration 2A, 2B, and 2C, has there been no consideration of doing like a morning cohort, an afternoon, and an evening, or some form of block scheduling? I know we've done block scheduling in our schools without a pandemic, and sometimes you don't have the amount of movement in block schedule, and I think there'll be a little more safety there. I guess I was hoping for a few more examples of things we could think about or try in our hybrid group. And, you know, you don't have to answer me now. I'm just throwing this out. I realize our time is 5 minutes away from when we should be done.
Well, let me respond to that quickly. Let me respond to that quickly, because what we want to be able to do is to provide options. And this has been a vetted option from our principals, and it's a cautious, phased approach. And so the initial blush from our department leaders, because our teachers and our department leaders and staff have seen us, they're open. I would like to open this up for even greater conversation as early as this Friday to include our principals and APAs, which is why I wanted them all paying attention, because if there is another option that's more workable, then we want to look at that more seriously. This is, I think, a very good example. Is it the example right now? I wouldn't say so, but it's one that it's conservative enough, but yet it allows a phased, careful, cautious approach to returning our students. My biggest thing is that they stay on campus. We don't want it gives us the latitude where they're not ping-ponging back and forth. But to your point, yeah, I want to get some more options. One of the pieces that we have to consider is that we are a high school only district. We have to be careful with the student schedule, with the ability for our students to continue on their trajectory of recapturing their credits. I don't want to put the graduation trajectory with their credit attainment at risk if we do something like that. So all those pieces have to be carefully thought through. That's why this one seemed to be the most logical one for our principals. But we're going to go back to, because this is phase one of this planning. The next phase two is coming up in a few days.
Thank you, Dr. Midville.
Mhm.
Another big piece is going to be the cleaning and sanitation of our buildings. And so we need to consider that in our phased option as well. If we do a morning, afternoon, and an evening, we may not have that time to clean appropriately, and that would actually impact our students and staff as well.
I guess I was asking because we had talked to our community about 1 day a week and even 2 days a week, and it was not well received. Now, of course, that was very early on and feelings may have changed. So I was trying to find some other options to have small groups, but more time on campus and then some time at home virtually learning. But thank you, gentlemen. I appreciate that we're still looking at the issue and the hard work that you're doing.
Thank you.
Thank you, President Hodge.
Sorry
Hey,
about that, Ms. Lau.
That's okay. That's okay. Hey, Dr. Mandeville, will you just really briefly talk about how you are in discussions all the time with our neighboring districts like Dr. Castile, and I'm sure Kyrene. I know I talk to board members I know in other districts, and we're all in the same boat, and we're all trying to do the same thing. And it may not seem like that to the general public, but it really is. And it's unfortunate that an arm of our Arizona government didn't take over some of this and distribute it, and then we didn't have to all recreate what we're doing, but nevertheless. But I think that's good to know that we are talking with other districts, because, you know, if someone discovers a key to this, we're certainly sharing information.
Thank you, Board Member Lau. Absolutely. I do speak with my colleagues in other districts in the East Valley mainly, but also with Phoenix Union High School District. You know, again, we're unique in that we are a high school only district, right smack in the middle, and we serve 2 districts. So, and we have this giant geographic area that encompasses a variety of zip codes, and so it just adds to that. It's certainly not something that we can't solve, but every district is facing the same decision around start time. How are we going to begin safely? What that looks like for elementary is a whole other set of challenges that I'm glad we're not facing right now. But at the high school level, I was just talking with Dr. Castile, and I just got a text earlier today from the superintendent in Gilbert. They're all looking, okay, what day is going to be the best day where they can throw the arrow, the arrow at the target and see where it lands, and then it's going to be based on your data anyway. I have impressed upon them, you guys, how can we begin with students safely? We've got to have the health mitigation plans in place first and foremost and clearly understood before we can even think about. Now, fortunately, we've rolled foundationally a lot of the plan, if not all of the plan, people need to be reminded, okay, my behavior needs to change. And that, to me, I keep pressing upon that, but that's the key piece with all of this. If we're going to receive kids in a phased manner for, you know, a part of the week or a greater part of the week. And so, but every district, Chandler included, is struggling with that. And this isn't easy. There's no rules for this. The only information we're given by the state is that when you meet this metric, you go into hybrid. There's no guidelines about what hybrid means for any district other than it's some distance learning, it's some in-person learning. And how generic and general can you be? Maybe the behind the scenes planning is so that districts can be creative and personalize their plan to their students and to their community. And that's really what we're trying to do, is to make the best decisions, which is why we're encompassing making decisions around zip codes. We've got to factor that in realistically. What would that look like? Because you just look at the data and there are certain areas that are they're looking pretty good. So why wouldn't we begin in some way, shape, or form with that school? So, but those are the questions that we're going to be facing tomorrow when we meet again, and Friday, and all of that. But we are very prepared. We need to be secure on which approach we're going to take for the hybrid model.
Thank you.
Mm-hmm.
Okay.
Right.
Okay. All right. Sorry about that, Vice President Garcia. I'm keeping myself on mute. Go ahead.
No worries. Thank you, Madam President. And thank you all again. I mean, I really appreciate how much thought and detail you continue to put into this and meeting over each update that these data releases are provided each week. And also thank you for always thinking about the schedule integrity, because I think that is going to be critical to our students' ability to stick with coming back to and going back into the motion of things. And then to Mr. McDonald's point of deep cleaning, having sufficient time to do it, I think, is incredibly important. So we don't have a situation that we're not going back into kind of an outbreak if there's insufficient cleaning. My question is with respect to for phased in opening with respect to asynchronous and synchronous learning. So from what I understand is essentially from scenario 2, phases A, B, and C, Wednesday is essentially used as a deep cleaning to separate the cohorting for cleaning, PLC day, etc. However, on the days that a student or a cohort is not on campus for in-person, does that include synchronous at home, or is that asynchronous at home?
That would include synchronous at home, I believe, Dr. Mendeville.
Yes. Is my on? Yes.
Okay.
Yes.
That is all I have. Thank you.
Thank you, Vice President Garcia. Board Member Barraza.
Yes, again, thank you for the presentation. If you would please convey my thanks to the COVID-19 response team. This was a very comprehensive presentation, lots of input, lots of data. There was a lot of work that went into this, and really, you know, like I really appreciate how much they've taken on, you know, extra responsibilities, everyone in the district, you know, from district office down to each individual school. I hope that I know that we will continue to be dynamic in this aspect. I really feel confident that Dr. Mendeville has been very accommodating to being able to be flexible for all these instances. Sometimes I feel that he's more accommodating than I'd like him to be, but I know he's always doing the right thing, and he has the information that I don't, and he always really does do the right thing. So I just want the district, you know, and the community to know that this was not a haste plan. This was very thought out, and it's going to rely on the community, rely on our staff to continually to improve it. But I really appreciate it. And if we can continue to convey information to our community, overflow them with information, I would appreciate that. As far as earlier in the presentation, there was, we're not having water fountains. What am I supposed to do as a student or staff member if I want water on campus?
Actually, Mr. Barraza, we are going to have the water fountain. We'll have the water refilling stations. We will provide cups if necessary. What we want to do is make sure that technically I have to have the water spigots on, at least to serve one water fountain for every 100 students. And so they'll be on. We're just going to deter them from using the bubbler part and use the refilling station. And then, of course, maintenance-wise, we're going to wipe those down on a constant basis.
I appreciate that. In terms of the classrooms, scenario for the hybrid model, scenario 2C, it sticks with me, makes me feel a little uncomfortable because it's almost like the traditional model. Can you give me an idea of what 2C would look like in terms of a full time? I know you went over saying that they're going to continue with the mitigating procedures, but does that mean that in the traditional sense, we're not going to do the mitigating procedures? I just want to know what's the difference between the two, traditional and hybrid 2C.
Correct. When you're in hybrid 2C, thank you for the question, by the way. When you're in hybrid 2C, those mitigating factors still exist in hybrid. So we would still try to social distance as much as possible. We would still be using the screening process. We will still be using the mask. We still will be using, all of the other etiquette and the mitigating factors, all 10 of them. When you go into a scenario 1 where there's all, 6 of those at the end of that table fall off. So it won't be required to do social distancing any longer or wear a mask when we are in scenario 1 full.
Okay, I appreciate that. I see the difference. Let's say I'm a teacher and I have a parent going through chemotherapy and I'm not comfortable going back on campus yet, or maybe I did and now I don't feel comfortable. Do we have a plan in place, or what are the expectations of our staff in terms of classified and unclassified? If I'm paid hourly and I have the same scenario, and if I'm classified and under a different category, what do I do?
Board Member Barraza, I'll take that one, and Mr. McDonald, if you want to add to that, and Dr. Keller, if you're online, you may want to add to that if you think it's necessary. The COVID protection under FFRCA affords these individuals, time off without any penalty and that kind of thing. So those laws would be applicable to those employees. I think you asked, part of the question was with what would the teachers do if they don't feel the same would it go to our teachers? Part of the challenge is to determine how many kids are going to be on campus, because we have a segment of our students who are chose to be on the exclusive Tempe Union Online. Okay, so it's strictly online. We have about 1,000 kids that are sprinkled throughout the district. We have the next group of families that we've tried to be accommodating, and that is that if they still feel uneasy or insecure about returning back to campus, even in a hybrid phased cautious approach, they can elect to remain at home. Their students participate virtually as they are doing right now. So that's the other layer of information that all the districts are trying to determine right now. So they're trying to get those numbers so that we can plan appropriately. How many kids do we realistically expect to come to school in person? And so that's our next phase of information gathering. And so we will be sending out a survey sometime next week for families to give us an idea and an input on, what are their intentions. Providing we have this health mitigation plan in place and we do that with a high level of fidelity, would you consider sending your kids back to school in a hybrid model? So there's those pieces, but our employees they're protected under those under the FFRCA Act.
Okay, I appreciate that. And if there's opportunities, for volunteerism, I personally wouldn't mind volunteering and maybe advising for the labs as opposed to a teacher going in if they don't feel comfortable. I'm always happy to go in and supervise the students and make sure that they're working on their curriculums, working on their projects. So if there's an opportunity for that for community members, maybe professors, I know a couple of people that teach at the collegiate level that would be very happy to also assist in that manner, or with grading or anything in person. So if we can utilize that, I think that would also be able to create a safety net for that when a teacher or a staff member says, you know, maybe I don't feel like I can show up because I'm taking my parent to chemotherapy, or my child has an autoimmune, you know, deficiency disease, or anything, you know, of so many scenarios that we can come across. So I'd be happy to volunteer. I know there are. So if we can look into that perspective. I guess the last thing I just really have, you know, is more or less just things to think about. I would really like to see additional study sessions. I think we're going to need one in terms of procurement. I know that we're going to be faced with a lot of challenges, you know, and if we're going into an online model or back and forth, there are just kids that can't afford pianos, and if they're taking music class, it's really difficult to do it at home. So being able to provide some resources for take home, from art kits to dance shoes to lab kits to anything, I know it's probably going to have to come up. And I know the district has been thinking about it. We've been having conversations, you and I. So if we can have a study session when the district's ready, I think it would be beneficial to see how we're going to need to spend money in the coming semester, or in the coming year, really, overall. That's all I really have. Thank you, everyone. I really am impressed by the presentation and all the work. I'm really thankful to be a part of this district, and I feel that we're doing the responsible thing by focusing on the guidelines. Thank you.
Okay. All right. Well, thank you, Board Member Barraza, Dr. McDonald, Dr. Mendeville. Thank you so much for the presentation tonight. We have a lot we have to digest and go over. It was phenomenal. At this time, it looks like we're going to close out, and I wish everybody a great night, and we will see each other. Our next governing board meeting will be on Wednesday, next Wednesday, the 26th, what is it? The 2nd, September 2nd. So we'll see you guys on September 2nd, and you guys have a wonderful night.
Thank you for your time.
Thank you. Good night, everyone.
Bye-bye. Bye-bye.